Podcast 19, Week 21. Welcome to the podcast, Your Pregnancy Week by Week. This podcast covers the 40 weeks of pregnancy in 38 segments and is based on the book Your Pregnancy Week by Week by Dr. Glade Curtis, MD, and me, Judith Schuler, MS. The information in our books and podcasts is a general informative guide about pregnancy. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctor. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your pregnancy concerns, questions, or interests into words. The goal of every pregnancy is a healthy mom and a healthy baby. To that end, our podcasts cover many topics. In each weekly podcast, we'll highlight information contained in the same weekly discussion in our book. We suggest you read each weekly chapter to learn further information, such as how baby is growing and changing and how you're growing and changing too. Our book also contains illustrations of changes in baby or you, advice for dads, charts, lists, boxes, an exercise for every week, a comprehensive glossary, hints, tips, snippets, and blurbs we just can't reproduce in a podcast. So let's get started on this week's discussion. We're going to look at week 21. A lot of people don't know much about celiac disease, but it can impact you. With celiac disease, you're allergic to gluten and your intestines absorb fewer nutrients. The disease may appear for the first time during pregnancy or after childbirth. Symptoms can be the same as for other problems, so it may be missed during pregnancy. A blood test can determine if you have it. Many grain products, which you can't eat, are fortified with folic acid. You'll need to get folic acid in other foods and supplements. You may need to meet with a dietitian to develop a sound nutritional meal plan. Are you craving a specific food? Food cravings have long been considered part of pregnancy. We don't understand all the reasons, but we believe hormones and emotions may be the culprits. If the food you crave is nutritious and healthful, eat it in moderation. If it isn't, try to substitute healthy foods for unhealthy ones. You may be wondering what foods pregnant women crave. If you guess chocolate, you're on target. Other women crave sweets of some sort and citrus fruits and juices. Craving ice can be a sign of iron deficiency anemia. An inflamed tongue is a common symptom of this type of anemia. Ice helps cool your tongue and makes you feel more comfortable. Some women experience pica during pregnancy. That's craving non-food items like dirt, clay, laundry starch, chalk, paint chips, and other things. Pica can be harmful. If you have pica cravings, call your doctor. He or she will develop a plan to help you deal with these cravings. On the opposite side of cravings is food aversion. Some foods you've eaten without problems before pregnancy may now make you sick. Again, we believe the hormones of pregnancy are involved. If you have food aversions, try to substitute other foods to get the nutrients you need. Talk to your doctor about ways to deal with food cravings and aversions. He or she may have tips on how to get the nutrition you need. Have you heard about varicose veins? When the valves of veins get weak or damaged, they become varicose, which means swollen or dilated. Varicose veins appear as large, swollen veins deep under the skin. They're caused when blood flows back through the valves and pools in the veins. Varicose veins occur to some degree in most pregnant women. They usually occur in the legs, but may also be present in the rectum. Those are what hemorrhoids are, and they may be found in the vulva. Changes in blood flow and pressure from the uterus can make problems worse. Varicose veins may be more noticeable and more painful as pregnancy progresses, and they may get worse as you gain weight. Symptoms vary. For some, the main symptom is a blemish or purple spot on the legs with little or no discomfort. Other women have painful, bulging veins that ache, look purple, and appear twisted. In rare cases, varicose veins can progress to deep vein thrombosis, DVT. We discussed this in podcast 16. Women with blood clotting disorders, obesity, or those on prolonged bed rest may also be at risk. Call your doctor immediately if either leg becomes severely swollen, you develop sores on your leg, or skin near the veins changes color. Following pregnancy, swelling in the veins should go down, but varicose veins probably won't disappear completely. After pregnancy, treatment methods include laser treatment, injection, and surgery. Many women wonder if taking a bath during pregnancy is okay. Most experts agree it's safe. Just be careful getting in and out of the tub and make sure water isn't too hot. If you think your water has broken, don't take a bath. Women want to know how they'll know if their water breaks while they're in the tub or shower. When it does, there's usually a gush of water followed by slow leakage. If your water breaks while you're bathing, you may not notice the initial gush, but you'll probably notice the leakage, which can last for quite a while. My water broke while I was in the shower. I kind of noticed it, but it became really evident when I was drying off. The slow leakage of fluid that didn't stop made me realize my water had broken. Duh. The term vaginitis covers vaginal symptoms like itching, burning, irritation, and discharge. Bacterial vaginosis, BV, is the most common type of vaginal infection in women of childbearing age. Some experts believe it may be caused by douching and sexual intercourse. It's also more common in women who have an IUD. Your doctor can test vaginal discharge for BV-causing bacteria. Antibiotics can treat the problem. If left untreated, BV can cause problems for you and baby. Do you wear contact lenses? If you do, hormonal changes may cause eye discomfort and irritation during pregnancy. Hormones can also alter your vision and dry your eyes. Don't use any products for dry eyes until you discuss it at a prenatal visit. One solution is disposable contacts. You might also try your old glasses if contacts don't seem to work. Wait until after baby's birth to make any permanent changes. It can take up to 6 weeks for your vision to return to normal. Fibromyalgia can cause body muscles to ache, burn, and twitch. The problem usually causes chronic pain and other symptoms. It may lie dormant until triggered by a trauma such as pregnancy or childbirth. During pregnancy, your body produces many hormones that may affect the disease. Studies have found some women experience more severe fibromyalgia symptoms during pregnancy. The third trimester may be the worst, and symptoms may last as long as 3 months after birth. If you suffer from fibromyalgia, bring it up at your first prenatal visit. At this time, there is no cure and treatment is limited. Discuss the problem with your doctor. Today, it seems like people of all ages have braces. What about braces during pregnancy? If you already have braces, keep wearing them and keep every appointment with your orthodontist. If you vomit a lot, brush your teeth to clean off acid every time you throw up. When you get your braces tightened, it's okay to eat soft foods for a few days. If you're planning to have your braces put on, then find out you're pregnant, call your orthodontist. Ask him or her to call your pregnancy doctor to discuss the situation. Together, you can all decide whether it's possible to wait to get your braces on until after baby is born. Remember, our podcasts give you the highlights of what may be happening in any given week. Check our book, Your Pregnancy Week by Week, for more detailed information. You may also want to check out our book for partners, Your Pregnancy for the Father-to-Be. It covers pregnancy from a man's point of view and provides lots of valuable information a man may find very useful. If you want to find out more about our podcast, visit our website, yourpregnancyweekbyweek.com. If you're looking for something specific, check out the podcast topics list. It details topics covered in each podcast, so you can listen to a particular podcast or read a certain chapter week if you want more information, or if you want to check out something you missed or a topic we haven't covered yet.